Okay, we're going to look at treating this levator scap. Here's the shoulder blade. Here's the top corner. Attaches right here. It becomes very fibrous. It's a very, very chronic trigger point. Comes up and attaches in here. So I want to go right off the shoulder blade, right up and through here. She's going to just lay down until she finds that. You got that there? Sometimes you need a little longer digit because of the curvature of the back. She's going to deactivate this by applying pressure for 1 to 2 minutes. She can also create a myofascial release by moving the arm. She's actually going to stroke through the fibers of the digits by moving that scapula and stretching out that muscle. Again, she can also work on doing an oscillation technique by just pushing with her feet and creating a slight oscillation. She'll actually stroke through the fibers. And this is all described in the 20-page guidebook, but just to show you briefly the different techniques. Very simply, just rest 60 seconds to 90 seconds on the trigger point and it should melt away. Now that's the levator scap. And remember, once you've deactivated that, come down a little bit this way, come up a little bit this way, come over a little bit this way. Look for latent trigger points that you weren't aware of that will also stimulate pain. Many times the rhomboid kicks this off, so you want to come down here and check this out. Again, this whole this whole neck problem here can many times be coming from weakness and involvement in the infraspinatus. So if you're having neck problems and you've treated this, you may want to come down and search out the infraspinatus, rhomboid, and move up the neck. Next one is the upper trap. That again is a very common one. People are constantly reaching back and massaging that. And you're going to replace someone's thumb right down on that trigger point with a digit. The way to do that is to take one of the longest digits at the most angled hole, and you lie down, not directly on it, but it's right, and then you just push with your feet, and you're going to push upward. Now remember, it's not down on, you're pushing your body up this way against that, and you'll get pressure. And that one is very common to give you pain up and all the way around and into the head. You may find a sensation going all the way into the eye. And you can actually stroke through that by actually rotating the head, and you'll actually stretch the fibers and it'll go through that. The digit will stroke through the small fibers of the upper trap. Again, it's easy to find the active trigger point because it's like a sore thumb right out there. But you want to move up into the neck and down towards the shoulder, just searching along the length to make sure you're deactivating any latent trigger points. So that's the upper trap. Those two are very common, very important to get in neck problems. Or you can come up and do right on the suboccipital. The suboccipital muscles are right up underneath the skull, the hard skull. We have soft tissue in here, and these muscles are very common to cause radiation up and across above the ear and into the eye. So here we can apply pressure for 60 to 90 seconds on the suboccipital muscles.